But I'm not a believer in. Thank you, Bethan, for recording it. I'm not a believer in meetings being better because they're longer. I'm kind of the opposite point of view. If I'm seen to be sort of moving things forward, please don't think I'm being rude or anything. I'm not. That's not the intention. It's just let's crack on and keep focused. Ridian.
Thank you, Alistair. Two things. My team have been instructed for brevity. Okay,
excellent.
So that will suit you
and
colleagues. And just to call out to Alex Percival, the temperature is such that you don't need to wear a jacket to this meeting. I'm sure you have chair's permission to remove your jacket.
I'm bringing suits back, Ridian. You know that.
Hey, listen, I'm bringing ties back. So I'm wearing my tie, but yeah, jackets. I just about remember what jackets look like, Alex. Pre-summer. But Martin, good to welcome you as well. Good to see you at the meeting, which we're just going to kick off. I was just mentioning that for all the right reasons. Hopefully, I'm quite keen on moving things forward and brevity rather than longevity, and that includes me. So tick me off if you find me talking too long at the meeting. But I'm keen that we keep things moving. So relevant interventions, absolutely please. But if I think it's moving into a conversation, I'll probably move it along. And please don't think I'm trying to be rude or being rude. So if we finish earlier than the scheduled time for the meeting, that's good by me. Hopefully that would work for you too. Michelle, welcome. Good to see you there too. You obviously have the magic button that says join within the next 60 seconds, Michelle. You're good at that. Ivan is the opposite magic button. Yeah. He's got the one that says
don't compare me to Ivan.
Join 3 minutes after the meeting. I can only say that because he's not here. Jamie, welcome. Chris, welcome. Nice to see you all there. And Alex, please do take your jacket off. It sounds like it's hot where you are. But great. Look, we're just hitting the 2 o'clock marker, so I'm going to start the meeting. And I see Julian just joining. Good to see you, Julian. But I'm pleased to welcome everybody today to today's DHCW Digital Governance and Safety Committee meeting. And in the interest of time, rather than ask you all as committee members and those in attendance to introduce yourselves now, I'll ask if you can do so as you present an item or if you speak. There are a number of apologies which I received, which I'll just note. David Selway, there's Darren Lloyd, there's Rachel Powell, Sam Lloyd, Keith Reeves, and Laura Tolley. And I hope they're all having a great summer wherever they are. But I expect it started to rain, which can't be a bad thing for all of us, can it? And Alex, thank you for attending as well to support Chris on item 3.21 on Canis decommissioning. Beth is with us this afternoon and is going to be leaving us imminently. I just want to say thank you for joining the meeting at the start, Beth, to record and for the purposes of the minutes, as the secretariat itself is on leave. So thank you very much, Beth. And I'm sure you've got very pressing things that you will want to crack on with. But you'll be able to catch up this evening by watching the entire meeting online. But thanks, Beth.
Alistair. Thanks.
And well done again to your son and the GCSE results. That's brilliant. I'm going to note that there is a private session at the end of this meeting where discussion of matters that are not appropriate for the public domain that will be held there. A summary of these discussions will be reported to the next public session of the committee via the abridged minutes. The committee papers and minutes have been uploaded to the DHCW website for members of the public to access. And the meeting will be and is being recorded, and the recording will be posted onto the DHCW website for members of the public and stakeholders to access also. So we'll have a short 10-minute comfort break for those of you who are joining the private meeting after the public meeting. And finally, the public part of the committee is scheduled to run until 3:30 with a private session beginning after a 10-minute break. And if we are able to finish a little earlier, then great. It will allow us all to be able to do something else constructive with our time. And so I'm going to move on to the first item of 1.3, which is declarations of interest. Does anyone have any declarations of interest to make to the committee? I see none, so we'll move on to item 1.4, matters arising. Does anyone have any additional matters to bring to the attention of the committee? I see none, which says a lot for the agenda planning. So thank you for the Secretariat to make sure that the agendas are so well prepared. And please note also in part 2 of the agenda, as we move to it, the consent agenda, that the consent agenda items were circulated prior to the meeting, and I haven't received any comments to go through. However, for the purpose of the minutes, I'll just confirm what the committee is being asked to do as we get there. And 2.1, minutes of the last meeting, which were public and private abridged, and you're being asked to approve the minutes. Do you have any additions or changes to propose? I see none, so we'll move forward to the forward work plan, which is 2.2, which I would ask you to note for reference, and of course, if there are any in the forward work plan items that you believe should be on the forward work plan, I'm sure you'll bring those to our attention as we move through the year. Moving on to 2.3, Section 28 regulations. The Section 28 regulations report is here for assurance. However, Gethin Bateman is also in attendance should there be any comments on this item. And I'm really asking to see if there are any comments, or if Gethin, you wish to make any specific comments about this item. I see nothing and no hands being raised. Therefore, the committee is being asked to note the Section 28 regulations for assurance. And that allows us to move on to the main agenda, which starts with 3.1, the action log. There were 2 actions on the log, which always makes me feel a bit like Captain Kirk when I say that, but it's basically 2 key items, both of which have now been completed. 3.2, the corporate risk register, to include Canis decommissioning process. And this report will be led by Chris Darling, our Director of Corporate Affairs and Board Secretary, for your discussion and comments. I'll mention that there are 7 risks assigned to this committee, 3 documented for the public session, and the remaining 4 are classified as private and will be taken in the private session after this meeting. Alex, as said before, Alex Percival is in attendance to take the committee through the report itself on the Canis decommissioning process. And I don't know, Chris, if you had any introductory comments to make, or we move straight into Alex.
Thank you, Alistair. Yeah, Chris Darling, Director of Corporate Affairs and Board Secretary. I just wanted, Alistair, if it's okay, just to note, as you say, there's 7 risks, and 2 of them relate to DHW functions and 0320 use of health and social care data. And I know there's been a lot of discussions over the last few months with Welsh Government colleagues. So before we get into the Canis deep dive, just see if Rydian or John want to update on the discussions and where we've got to help mitigate those 2 risks.
Sorry, Chris, that cut out specifically the Canis risk.
No, sorry, the data policy work with government, Rydian.
Right. Okay. So thanks to Darren and John for the work that they've been doing to crystallise the simple and complex things that would be needed to be introduced across the NHS in Wales for the sharing of patient data. To summarise, Chair, GDPR obviously allows for the sharing of personal identifiable information for the delivery of care, but you'll be aware of the clinical data repository and the NDR program and the Value in Health program and the work on population health management led by the CMO in Community by Design, which, to summarise, requires aggregated, validated clinical data to understand service provision, quality, performance, and inform how to improve care everywhere for everyone in Wales. We've had a change of government, as we're all aware, and there's been a ministerial announcement on the review of data sharing. There was a committee structure set up. In fact, it was due to meet, I believe, on Monday, but was cancelled in light of that announcement. And I believe civil servants are looking at a new structure as how to collate expert opinion on how best to deliver the achievement that I've just articulated. So that would be my summary, Alistair.
Thank you, Rudy and Chris. If I may just very quickly ask, do you know whether that encompasses health and social care, not just health?
Good question, Alistair. I'm unable to confirm that for sure. I do know that the applied position is to improve care everywhere, and that care includes the social determinants of care. And my comment would be that the infrastructure within NHS Wales has been designed for the collection of data from NHS services. That does not exclude social care, but the process at the moment is predominantly focused on collecting the secondary care and the primary care, the GP data, into a way to inform, as I've just explained.
Great, that's really helpful, and I'm sure we'll come back to this when more is known and more is clarified, because it has real potential to have a lot of impact, I think. So thanks very much for the summary. But back to you, Chris.
Thanks, Chair. Yeah, I'll hand over to Alex now. The last meeting, you'll recall, Chair, that we talked about the CANIS risk, the fact that it's significantly reduced, and that we would do some work between meetings to bring back the position just to confirm where we've got to, so it's on record. So I'll hand to Alex.
Thank you.
Thanks, Chris. Thanks, Chair. My name is Alex Percival. I'm the head of planned care programs in DHCW. I am presuming that everyone's had the opportunity to read the paper, so I'll just offer a quick kind of overview of the position before we move into the discussion around the risk. So the paper relates to the decommissioning of the the Cancer Network Information System Cymru, or CANISC, which is a legacy system that's historically supported cancer services across Wales. The purpose of the discussion today is to look at that current position, consider the remaining residual use cases of the system, and discuss the recommendation around removing the associated corporate risk from the risk register. CANISC has been end of life for several years. It's a legacy platform that's been built on technology that's reached the end of its supported life. As a result, that corporate risk was originally raised to highlight the possibility of service disruption should the CANIS system fail. In order to address it, as part of the wider work of the Cancer Informatics Programme, a replacement cancer informatics solution was delivered. The programme itself wrapped up back in October 2025 and enabled services to move away from using CANISC on a day-to-day basis. The intention following the programme closure was to move towards full decommissioning of CANISC. That still has yet to be completed. However, user access has been reduced significantly, and we've transitioned away from using the system as a operational clinical system into more of an archive and reference source. So since March 2026, all remaining users have read-only access to the system. A number of legacy users have also been removed from the system in their entirety. No new clinical information has been entered into CANISC, and there's no live operational record that has been maintained within the CANISC system. As a result, our user numbers have reduced significantly. So the paper highlights that there are around 460 users in 24-25. In the latest quarter where reporting is available, that number's dropped down to 32 users who have used the system for historical lookup. while we've been trying to drive that number down to 0 in order to support decommission, we've been working to understand the residual use cases that remain, the reasons why people are still continuing to access the Canis system. And we've identified 3 high-level use cases that are detailed within the paper. The first of those is to do with subject access requests and requests for information relating to historic cancer care. So Canis contains a number of historic patient records relating to patients' cancer care within Canis. Velindre periodically deal with subject access requests and other requests for information that they need access to the information contained within Canis in order to respond to. There's around 300 of those subject access requests that Velindre deal with every year. So while it's not an enormous volume, there is an admin burden in not having access to that information in an easy way. The second use case relates to clinical audit activity and requests associated with legal processes. So similar in terms of nature to subject access requests, but from slightly different sources. They could include litigation, coroner investigations, etc., and mainly relate to historic palliative care records, but also to the wider Canis clinical history that's contained within the system. And then there's a third, more limited use case, which is around historic radiotherapy dosage information for compliance with the ionizing radiation regulations, and that information is occasionally required. Investigations seem to show that it's between 1 or 2 cases a month where the medical physics department within Velindre need to access that historic radiation information in order to deliver care plans. So one of the things I want to assure the committee on is that we've obviously done detailed work into these use cases and to identify that those residual elements within the system. The overall position, we believe, is that the original corporate risk has been reduced significantly. No live clinical system the Canis system isn't being used as a live clinical system any longer. So we feel that the overall position with that corporate risk is reduced. We also should assure the committee that all data that's held within Canis will be retained. So even beyond the front end system being decommissioned, all of that historic data will still be available within the databases for Canis, and therefore we're not talking about decommissioning Canis in any sense of deleting any information. It's more around switching off the front end system. In terms of the approach that we're taking to addressing those use cases and getting us into a position where we can finally decommission Canis, we've established a joint working group with DHCW, stakeholders from Velindre, the National Cancer Team and Cancer Network, and we're working through those processes at the moment for how we address each of those use cases in turn. And the intention will be, once those use cases have been addressed, that we'll retire the system fully when alternative arrangements have been put in place. So the recommendation that we're making to the committee today is that we should close or remove from the corporate risk register the risk, the HCW 0300, as that's been substantially mitigated through the approach of moving users to read-only, the delivery of the cancer informatics program. However, we recognise that there is still that ongoing activity, that work stream with stakeholders around addressing the residual use cases. And that's the essential position that's set out within the paper.
Thank you, Alex. That's a really, really excellent summary of the report, and the report itself, clarifies a lot about this. So thank you. Are there any points or questions that colleagues wish to raise? I've one myself, Alex, and maybe that you are not cited entirely on it for this aspect. But do you have any relative costs of the CIP versus Canis in terms of how it applies to DHCW?
In what context? Apologies.
Go
on.
Yeah, please.
Alistair, obviously, I've lived this for over a decade. There was an SLA for Canis from with the health boards. that SLA was not necessarily fulfilled, and ENWIS, as the time, absorbed those costs from core. Since a restructuring of the funding, the CANISC replacement program has been funded through a remit letter in core. So our team that is specifically ring-fenced for cancer are in our annual core funding.
That's really good to know, and thanks. Appreciate that clarity. Just one other, if I may, which is I'm sure a big aspect of the parallel working of the systems in that sense before we switch off CANISC is to ensure or minimize the possibility of gaps appearing in terms of archived knowledge and new information. Because it has already moved to read-only, have we defined any risk in that aspect that there is no more input, or since it's moved to read-only, there has been no more input information? And have we defined any specific risk around that period from moving into read-only when there isn't any update?
So certain services transitioned off it in a controlled way, and you'll be aware that the SHA board has heard how Velindre moved entirely off CANISC during that period, and that the colposcopy program has moved off it, and that palliative care has now moved off it. Alex was quite right in terms of the availability of historical data should it be required for audit purposes and validation, and that was a key commitment that we've met. Those patients that are live and within the system, Alistair, their record has actually been summarized and moved into the document repository and is accessible to clinicians in WCP. You may not remember, but there were less than 2,000 users of CANISC. At the time, at its peak, there are 44,000 users of WCP. So the cancer record now sits in the holistic record of the patient as opposed to siloed. And this brings obvious advantages. So I'm confident that there are no gaps, Alistair, particularly given that what used to happen in CANISC was information was taken from other systems and cut and paste into CANISC for those oncology colleagues. Now, of course, those colleagues are in the record where all the results and all the imaging and all the additional care information is present.
That's really good to hear, Radian. And if we link this to the previous item on data sharing, it would appear to somebody like me who is not involved directly in this, that there are real advantages in having all of that together in one system, that, from the data sharing perspective as well, whatever it comes out of the current work.
Yeah, massive advantage, and some patient safety issues that are worth noting. Yeah. So total body radiation during the period of a patient's lifetime is an important safety feature. If you've got those radiation dosages in separate systems, you might overdose a patient. The presentation, my specialty of pelvic cancers, sort of after pelvic radiation, if I as a clinician can't see what that patient has had, it's difficult for me to assess that risk. And of course, then there's the scheduling of high-cost systemic anti-cancer drugs that have significant side effects. And those patients who might be immunocompromised or have specific disease conditions that are more likely to result in infection or problems, that record is more visible. So there's a massive patient safety improvement from the delivery of accessibility of a total wide record rather than a disease-specific record. Thank you.
That's really excellent, and I definitely want those points to be captured in the end report as we get to it in the next in a few days. So thank you for that. I don't see other hands up, so I'm just going to remind the committee that was for discussion, and I'll put it this way for noting. I think they really are very, very important items that we've just covered. So it's good to have the report and the clarity around that. And thank you, Alex, for taking us through that, and Radian for the clarity of the responses. I'm going to move us on to part 4 in the assurance agenda. The 4.1, the incident review and organizational learning report. and this report's led by Michelle Sell, the Director of Programs and Engagement for Assurance. So Michelle, I'm going to hand over to you, if I may.
Thank you, Chair. Appreciate that. As you said, Michelle Sam, Director of Programmes and Engagement. I do have the pleasure of chairing the Incident Review and Learning Group, which is something I've done for some time now, and is an area I'm particularly interested in as an organisation. I think we're always interested in learning and how we can continually improve. So it's an important group. I would have to give credit, though, to Keith Reeves, who is one of my colleagues who has developed this report and routinely presents the report to the committee. So hopefully you'll bear with me this afternoon. There are some key points I particularly wanted to call out. There's quite a lot more detail, so anyone who's listening in, you may want to look at the detail in the report. As I say, I'm going to focus on a couple of key things, and then I'm happy to take any questions if that's okay. So what we do as a group is we look at significant technical incidents. So that's the kind of incident review where that part of the name really comes from, or came from historically. And we look at them in relation to learning. So not necessarily the technicalities of what happened or how it was fixed, but any wider points of learning that we should take forward. And we're very keen, and I will come on to that in a bit, to look at ways that we can broaden that into other aspects across the organisation. So there was one, what I would call material incident in this reporting period. So the reporting period from the 1st of April to the 30th of June, quarter one, and that related to an outage in one of the data centres. So Digital Health and Care Wales operates out of 2 data centres in Wales. So that's how we achieve resilience, if you like, in terms of the digital services that we provide. And a number of our services run in those data centres. We have other services that run in the cloud or are run by third parties. So it's a bit of a mixed environment. So we had an issue in one of the data centres which actually related to power and the availability of power into the data centre. I'm not necessarily going to drill down into all the technicalities, but only to say the loss of a data centre, as I'm sure you can imagine, has quite a material impact on the services that we deliver across the NHS. Helped, I would have to say, by the fact that a number of services had been proactively moved out of that data centre already before the failure. So there was some really, really good work, I would have to say, from the technical operational teams within DHCW. So there's kind of very proactive management around the data centres, as you would expect. But we did experience some service failures in relation to that power outage. The actual impact, the materiality of the impact, it was at the end of June, and it lasted about 27 hours, just over 27 hours, I think. So again, pretty quick recovery, and there were some residual tasks. So we will be looking at that in more detail. We've made some changes as an organisation, particularly into our service management area. So we've got a major incident management team now, and we've got deep dives into these major incidents. So there's a lot of work and a lot of detail that will come out of that in terms of lessons going forward. So that would have been reported to Welsh Government. And it would have been reported under something called the NIS directive, so Network and Information Systems. And that's because where an incident happens that will impact services, because digital systems are increasingly key to NHS services, then we would make those reports, and that was done as required. So a couple of other things then. So we've got complaints. So we received 5 complaints. We are open. We've got a clear and published procedure if anyone does want to raise any issues or concerns with our services or the organisation. Those are managed through our corporate governance team that Chris leads. And we had 56 inquiries. So we've got some comparative numbers in the report. We go through kind of peaks and troughs in terms of inquiries. I think we're still getting quite a lot of inquiries coming in relation to the Dental Access Portal. So the Dental Access Portal is a system that we developed that is available across Wales now, and as a really important job, I'm sure, again, anyone listening in would know, it's quite tricky if you're trying to find a dentist in the NHS in Wales, can be. So this is a new service that's been made available. I think sometimes the inquiries that we receive, we deliver the technical solution, if you like, the digital solution. We don't actually manage the dental services themselves. So sometimes we pass on inquiries to our health service delivery partners. But those details are all in the report. So What we really focus on as a group is looking, as I said, at the reviews and trying to understand what's the learning we can take from that. Are we making that continual improvement? So we considered 3 reviews in this period. Again, the details are in the report, so I'm not going to go into too much of the detail. One was a technical type incident which related to the NHS Wales websites. So DHCW supports websites across the NHS in Wales. And we had an issue there, and we considered the report to understand the lessons learnt. One related to customer feedback and service improvement itself, in fact, which is quite interesting. So what you'll see is there's some stats. The service desk do an excellent job, I have to say, in the organisation, and really keen to understand the feedback from our users. And these would be, people working within the NHS and healthcare across Wales, and how they consider our services to work. So there's some good reflections there, I think, in terms of how we can do even better in terms of harnessing that feedback and improving services. And the third review that we looked at was in relation to our ITSM toolkit, which sounds very exciting, but it's actually the system. So we've recently procured a new system that is in the process of being implemented, which supports the support of our system. So the service desk, the way in which users can report incidents, the way in which we manage our systems and services, and we're going through a process of replacement at the moment. So in the group, we considered initial lessons learned, which were principally from how that was procured and approached. So there is some detail on those in the report. And the final thing I was just going to pick up, if I may, so the final review, and we've actually spent quite a lot of time on this as a group, because I think it is key in terms of how we move forward ourselves as a group. So I touched on it at the beginning, actually. The origins of the group really came from incidents, principally technical incidents, but increasingly we are trying to broaden the remit of the group, and as part of that we're looking at a bit of a refresh now, and I will bring this, or Keith will bring this back to the group once we've worked this up in more detail. We're planning to take some proposals through our management board now in September. So to look at ourselves really in terms of, I think, where we need to be as an organisational learning group. So less about incident management. As I said, we've got really good processes, mature processes now in our service management function, but more focus on the organisational learning. And, are we capturing all the learning opportunities? Are we truly in that kind of continual improvement process, and can we reflect and monitor and understand that is where we are? So there are some specific proposals that we're working through. As I say, we've got another workshop in September, and I want to run through some of that with our management board. We will come back to this committee and talk about that a little bit more. But I think, as I said, it's been a learning process even for us as a group, and I'm really, we've got really good representation in the group. It's something that needs continual review and improvement as we move forward. So I was going to stop there, if that's okay, Chair, but happy to take any questions. Thank you.
Thank you, Michelle. Really comprehensive and good stuff. It's such an important aspect. I'm just going to see if there are any questions. I have one, if I may, and you were beginning to touch on it towards the end, that one of the discussions that we have within our wider management framework and with the independent members is whether or not we should plan more organizational learning after programs have been delivered. And I just wondered whether or not that was something that you saw fitting into the organizational learning as much as it would seem to me that the fit is pretty strong there, in terms of organizational learning from our programs once they have been delivered. And that might be measured in months, or even, I dare say, might be in a year or two after programs to see their full delivery. Would you see that as having a natural fit?
Yeah, thank you, and I particularly appreciate the question. If you, with my programs hat on, yes. So it would be part of our process. We would expect to do a lessons learnt at the end of a program. There are programs where we will do that in midpoints as well, and those do come to the group. So that is something. And what we've also been working on with our portfolio management office is looking at how we not only discuss at the group, but how we really embed those lessons in future programs. I think that's the other challenge. I think it's a really interesting point you make then about reviews later then, if you like, in the journey, and that there's probably a number of aspects to that, I think, on there. There's the whole kind of benefit value assessment, which I know is something that we're really focused on at the moment, and that's probably something we're not routinely doing, I'd have to say. So that kind of later in the process, I think, is definitely something that we can look at, and something that we could build into our process. So we're definitely looking at the benefit side of it, but that kind of wider learning. And then I think it's that kind of continuous improvement loop then, isn't it? So we learn. Did we then take those lessons forward, and did we then see the improvement in subsequent programs? And I think that's where we need to look at that whole kind of across the whole portfolio, really. So we can definitely look at that going forward. Thank you.
And there's probably a win-win there as well, because if we know more about delivery working, we can share that with stakeholders so that there is more of a factual basis for an understanding of what we've done. I see, but thank you, Michelle. I see Chris and then Rydian with your hands up. So Chris, first of all.
Thank you, Chair. Thanks, Michelle. 2 quick questions. One was around the major incident, and you said it was the first time we've had an MI with the new incident response team in place. What was the learning, from having had an incident response team? Were there any takeaways from that? And the second one was just around the board listening and learning item, and whether this group going forward could consider things that would be appropriate for board listening and learning. So I know Rydian champions this and leads it in terms of coming up with ideas every other month, but it strikes me that the group would be in a really good place to identify some learning for the board as well.
Yeah, thank you, Chris. Yeah, Michelle.
Sorry, Alistair. Yes, thank you, Chris. Yes, definitely be interested, and we really appreciate the opportunity. I know Keith does as well. The support of the committee and the oversight to learning, I think, is really important, and definitely it would be be very pleased to do something at the board. In terms of the major incident management team, yes. So we have. They will have led on a number of incidents. I think this was the first, as you say, really major issue, and it was a bit of a baptism of fire, I think, for the team. They did a great job. It is tricky, and what actually happens behind the scenes, I know you all know this, Chris, but in this kind of major incident, it's actually quite a large team that responds. So we have what we call our gold, silver, bronze, or our kind of response structures. So those stood up alongside the MIM team. I know that they've done a specific review. I think we've got another workshop coming up to make sure that we've captured all the lessons again. So we haven't necessarily worked through all the detail of that in the organisational learning group yet, but I know service management are leading that, and there will be lessons in that. And there are lessons already we've talked about that. I mentioned about the new service management tool that's being deployed. I think we're already seeing there are some benefits to that in terms of the way in which we capture and structure in a system which is easily accessible to lots of people, the way our services are configured, for example, so that we've got information probably closer to hand. And communications always come up in an incident. As I say, I think it was managed really well, and the recovery was actually, was pretty quick, but communications is always an area that we look at. I know the head of service management has arranged a specific session to look at communications and areas that we want to specifically address and things going forward. So I think that one is still work underway.
Great, thanks. And Rydian.
Thank you, Alistair. A couple of things. Well, first of all, I'd like to put my thanks on record to DHEW for doing what it normally does in a crisis. Everyone pulls out all the stops, focuses on getting things up and running as soon as possible. That's a credit to the way that people work within the organisation, because they understand that there are clinicians and patients at the end of this pathway. Keeping the lights on is incredibly important. In my own unit, we had patients cancelled on the day for cancer-related diagnostic procedures, because in a paper-light, paperless system, if you haven't got access to the digital record, you can't safely proceed. I can reassure you none of those patients came to harm, but there was an impact. So when people say, oh, why should we be investing in infrastructure? or why should we be investing in cybersecurity, I have this one thing to say, Alistair, and that is, if you don't understand the value of digital within the NHS in Wales, switch it off and see what happens. So my plea goes to those that are in charge of the financial funding to ensure that we have robust and cyber secure systems. Please take that message on board. We can't predict acts of God, as I think the insurance companies call them, Alistair, but we can prepare ourselves for most of the predictable problems that happen with our infrastructure. And one of those is ensuring that we have robust, slick backup systems. And that is worthy of noting. Thank you.
Thanks, Rudy, and what point really well made. I sometimes make the reference to imagine the aircraft you're on flying without when the pilot turns off all digital systems. How would you feel about that? And what's the difference? The difference is that there's an entire nation flying on NHS Wales. So your point is very well made. Great stuff. Thank you, and thank you, Michelle, for the responses on that. The committee is being asked to note the report for assurance, and there are a couple of points coming out of that, I think, Michelle, that are really quite helpful. We'll move on now to 4.2, Information Governance Assurance Report, and John Sweeney, our Information Sharing and Integration Governance Manager, is with us to help us with this. And John, I'd ask you to pick out the key points if you may. Thank you.
Thank you, Chair. As you say, I'll bring up some brief highlights and happy to take any questions, of course. If I start with the main body of the report, paragraph 4.4.1 refers to WASPI, which is the Wales Accord on the Sharing of Personal Information, which is an all Wales framework that DHCW leads on. Just really to highlight that we're waiting for the Information Commissioner's Office to approve WASPI as what's called an approved code of conduct. There aren't many. I think there's only one in the UK at the moment. So just to highlight that we're expecting that decision soon in September, and when that approval is received, I think we will come back to the committee with an update on what that means, the implications and next steps. If I turn to the appendix, the upward trend in requests for information continues, and that includes requests under the Freedom of Information Act and subject access requests. The upward trend is largely driven now by an increase in subject access requests. So that's where individuals ask for their access to information about themselves. We've received more requests so far in 2026 than we did in the whole of 2025. I think it may be fair to say that the challenge is perhaps less around volume and more about the complexity of some of the requests that we receive. Often they include complaints, also mix in requests for personal data, so subject access requests, and potentially elements that relate to patient safety. So they can be quite complex. We are continuing to work with our colleagues across the DHCW to make sure we're clear on roles and responsibilities, and that we understand who's responsible for coordinating and responding to requests, and that DHCW meets its statutory responsibilities. We continue to support DHCW's portfolio of products, projects and programs, and the appendix provides some details of data protection impact assessments we've worked on in the last reporting period. I won't go into those in detail. In addition, the appendix highlights the number of queries we receive as a team that drop into what's called the action point system, which is how we manage requests for information governance support, or calls as we refer them. So we've broken them down into the report by main service area. And just to highlight really the volume of queries is fairly steady. It does vary by service area month by month, but that's expected. The last element of the appendix relates to what we call policy work. So this is relates back to the risk that we talked about in information sharing. So the committee may be aware that in DHCW's remit letter for this financial year, Welsh Government asked DHCW to support Welsh Government's data policy development. with the new government elected in May, I think it's fair to say there's been a period of reflection by ministers and officials, and we don't have clarity on exactly what Welsh Government expects of DHCW in this space. That said, where the opportunity does present, we do provide support. So for example, we provide attendees to forums like the Deputy Chief Medical Officer's Data Use and Sharing Group, albeit the last one was postponed. We coordinate an all Wales group of senior information risk owners and Caldecott Guardians. We represent Wales at the UK Caldecott Guardian Council. Of course, if we do receive further detail on Welsh Government's expectations in this area, we'll provide the committee with further information. That's it from my update. Happy to take any questions, of course.
John, and thank you. Yeah, I note for colleagues the key point that you raised at 4.1 that perhaps the key purpose of this is to assure the board that DHCW continues to meet its statutory obligations, and I take it from the report that that is the case, with the commentary that you've noted against that, I see no hands. If I may just raise one question around NIAS and reprocurement. We've had some discussion as a board and as in other committees about contract lengths, and I note that this continues until 2030. Is that, given how much NIAS has grown in terms of its use and application since it began? I think you've noted somewhere in the report, it was 2014 or thereabouts, that is 2030 the kind of length of contract, and I see Chris's hand up, it might be that Chris wants to come in here, that we should be looking for, or should we be looking for longer contracts? But I see Chris, did you raise your hand against this point?
It wasn't this point, Alistair.
All right.
I'm just coming on.
Yeah, so John, was there anything you wanted to say about that in terms of the contract length?
Chair, I'm not sure if Ridian was raising his hand.
Sorry, Ridian, hello.
I would defer to Michelle Sell, actually, and her expertise on procurement, but the structure of the contract is set up in a way that there are extensions on extensions on extensions. Michelle?
Happy to offer a general view, Ridian. I'm not close to that contract, but I would agree that does tend to be a good working model, particularly for digital services. So you wouldn't necessarily want a very long initial commitment period, but if the service is effective, the relationship is good with the provider, and you want to continue, then we would generally build in extension opportunities. So I think that for this type of contract, I would imagine that is the way that we've structured that, and that's quite a helpful thing to do.
Yes, particularly given that the supply market in this particular field, Alistair, is extremely small. Although through the open procurement we had a number of interested parties, it was clear that very few of them could reach the threshold necessary to be shortlisted.
Yeah, I think that was probably what lay behind my question, that one of the issues that we've considered as a board in recent weeks and months is extension on extension on extension. Does that meet the open procurement requirements? And so Michelle, I don't know whether you have any comment on this, and I guess what you're saying is not specifically on this particular contract that you would want to comment on, but more generally, is that an issue we should be concerned with, an extension on an extension on an extension, as it were?
So, in an ideal world, we would build that into the original contract. If we go to the market and we are very transparent, and that is what the commercial team do, that the period of this contract is an initial period of 4 years, potentially up to 8 years, then that is perfectly fine, because we've been transparent and suppliers understand that that is what we are aiming to do. That is the offer that's on the table, if you like. If we award a contract for 4 years and then for good reasons, and we've had a bit of that in this area, I'm aware, where we then have to continue to extend because this service is core to the way in which we deliver digital services, so we needed to maintain it. It would be highly problematic. I think it'd be a simple way of saying, John, if we had to stop this service because of our reliance across the NHS, then there are occasions where we have to make pragmatic decisions to extend to ensure that continuity. So we try not to do that, Alistair. Again, in a situation where we do find that we need to do that, we would still be transparent. So we would still be notifying the market or suppliers that is an action that we'd had to take. So it is a balance. Sometimes we have to make pragmatic decisions. We do try, certainly, and I know the team will work really hard to make sure that we're clear upfront about what our parameters are, so that if there are interested suppliers, and I was aware of that, Rydian, this is a niche area and it's quite complex in terms of the service that needs to be delivered. So it tends to be fairly limited in the amount of suppliers that could do it. Does that help with the question, Alistair?
I think it does, and it's a really difficult area from my perspective, because you're effectively navigating the space between a perfect world and pragmatic reality, and the latter invariably wins when it comes to health and security. And so very much take that point. Thank you, Chris. I'm coming back to you. Your hand is down, but you had it up originally. Is there anything you wanted to add?
Thanks, Alistair. It was just a question for John on the Data Use and Access Act that the report references and the potential implications for DHCW of that act. I know you're doing lots of prep for it, but the implications?
The act has come into force mainly. It was some staggered provisions. This act is nowhere near as significant as the introduction of UK GDPR, for example, and the new Data Protection Act back in 2018. We do have an action plan that we've worked through, which is in the main complete, and we were intending to take a report through DHW's management board and then potentially to committee to explain how we'd approached it. I mean, for example, some of the most significant provisions in DUA for DHCW was the introduction of a statutory complaints procedure for data protection complaints, which I know we worked with your team on, Chris. So you can get a flavour of the significance, I suppose, in that we already dealt with complaints, but this sort of provided individuals the statutory recourse to make a formal complaint alongside exercising their existing rights under UK GDPR. So the implications are not huge for DHCW. There are some actions that we've taken. We have a plan. We've largely completed that plan. Some of the outstanding things are, for example, the Information Commissioner is being replaced by an Information Commission, and we'll have to update all our resources with new reference to the new name, but that requires some regulations to be made to enforce that name, and then we'll have to work through all of our guidance to make sure we effectively reference the right organisation and that sort of thing. So not hugely significant, but a piece of work to go through, if that makes sense.
Great, thank you. Thanks for drawing attention to it as well, Chris. Okay, great. And the committee is being asked to note for assurance this report, and we so do. Thank you for taking us through it, John. I'm going to move us on to 4.3, which is the Information Services Assurance Report. And Martin Williams, we're pleased to see you there, Martin, the Data Manager Information Services, is going to pick out the key points of that report for us to also note as a report. So Martin, over to you.
Hi, thanks for having me here. So my name is Martin Williams, Data Manager in Information Services. I'm deputising today for Rachel Powell, who can't be here. So as you say, I'll go through the report which has been shared and pick out some of the key points. So to start with, in terms of the strategy, we had a strategy that has running until this year for the last 3 years. We are in the process of bringing that to a close and looking at next steps in terms of where we want to go. So we'll begin that process in the coming weeks about how we can continue to use information to support all the different priorities. I'll just go through some of the different areas and some of the deliverables and outcomes for each of the different areas. So starting with health intelligence, I won't go through all of the key deliverables, but you can see within the report that we continue to publish and release a large number of data sets and reports that are very well received. We've got robust mechanisms in place to make sure that these are distributed appropriately and that we're following all correct standards in regards to information governance and making sure that people are able to make the decisions they need to in a timely way. So, as I say, all the key deliverables for this reporting period are included in there, which people can see. In terms of the data enablement, and this is around supporting the larger products, and this largely focuses around the new data delivery group, the DGG, which has been established to be more clear and transparent about the migration of our services from the on-premises server to the cloud, to the Google Cloud platform. So it's really about engaging with health boards and making sure that they're clear on what our priorities are, what the direction of travel is, which data sets we are transferring from our on-prem services, which by now are in need of an upgrade. We're still using the switching service, which has been around for many years and is due to be switched off in a couple of years. So the good thing with this plan is that everyone can see now what the order is, when we're planning on doing things, and how it's going, and whether we're on track with that. So that's a really useful and helpful plan for everyone. It just means everyone's aligned, everyone knows what's going on, and if people do have other priorities, they have a process by which they can engage with that and suggest which things should be maybe moved up or perhaps moved down the list. In terms of the Valuing Health, this is an area of work that we do in conjunction with the Valuing Health Centre, which is part of performance and improvements. We do most of the analytical work, and there's a number of brilliant successes, including presenting at conferences and a lot of work with the OECD, the Organisation for Economic and Cooperation Development, Paris work, which is the patient-reported indicator survey. So there's lots of really good work that's going on in that area, of detail of which is in the report, and linking up data and using prompts. So some fantastic pieces of work, there. The ISD Assurance Group continues to meet and review the different proposed changes and assess information service impacts, and again, details of the volume that's been going through in the last few months is included in the report. And the idea of that group, it continues to ensure that we have consistency and control across all the activity that's going on. Those are the key areas in terms of that we're working. There was just a few risks and matters of escalation which just wanted to raise for the meeting. The first one, which we touched on earlier in the meeting, was around the data centres and the performance. So we heard earlier about the issues that there's been in one of the data centres, and it's still the case that if we are required to fail over from one of the data centres to the other one, which happens sometimes, and we tried it occasionally as well, we find that the performance is not as good when we're required to fail over. So this is an ongoing issue. So in the case where we are dependent on the second data center, we find that we're not able to perform to the same standard that we would do when we're reporting out of the data center one. So this is an ongoing risk, especially when we have the issues with the data centers. And then there's just to finish, there's 2 points around the wisdom data, which have been ongoing. So they're not something new, but just there continues to be an issue with Swansea Bay not reporting some of the substance misuse data from the Welsh Community Care Information System to the national system, which continuing to work with them on to try and see if we can make sure that they are reporting that, because obviously if we're not able to access the data from them, then we're not able to do a full complete national reporting. And then the last one was just around the future of wisdom and extending the data processing and supporting the future diabetes consultation at the DCN developments. But again, this has been going on for a little while now, and I think there is now a plan which is going to be going for the next 18 months. So it's good that there is a plan in place to try and deal with this, but obviously in the meantime there's a risk that we're not able to have all the information that we need to report as well as we would want to. So those are the key highlights from the report.
Thank you, Martin. That's very comprehensive, and I'm just looking to see if there are any points. One that I was going to ask, if I may, the word deliverables, it could be interpreted in different ways. Things to be delivered, as opposed to have been delivered, and even it could be interpreted as, wouldn't it be nice if we were able to deliver them? And that relates strongly to key outcomes and benefits. So when I read the report, I wasn't clear that we had delivered the items that were shown as deliverables, and I wasn't clear as a result whether or not key outcomes and benefits were for the future, we look forward to achieving those, as opposed to we are already seeing those. And in some cases, when I looked at them, it struck me that maybe they're a mix. I just wonder if you could clarify that, because I think if they are a mix, it would be very good to be able to pick out and separate out those items which have been delivered with key benefits and outcomes, and those that are not necessarily shown in a time frame, but still to be delivered with expected key outcomes and benefits. Could you comment on that, please?
Yeah, absolutely. And I think it's a fair point around just trying to be clear exactly what is being presented in the report. To be clear, these are things that we have delivered already. Some of them are ongoing pieces of work, so it doesn't mean that we're not revisiting them. In fact, many of them are ongoing pieces of work, but what's included in the report are things that we have already done. So if I look at something like the data delivery group, that is a group that has been established, it is meeting, we have a clear plan. Obviously, the migration of all the data sets is an ongoing piece of work that's going to take several years to complete, but we now have established the route and the plan for how we're going to do that. But yeah, on the whole, for the things that are included in here, these are things that have been delivered.
That's really helpful to know, and that's something we can note in the keynotes. It'd be helpful in future, without criticising the way it's set out. It would be helpful just to articulate that perhaps a little bit more clearly.
Absolutely, yeah. Yeah,
Chris, I see your hand up.
Thanks, Alistair. Yeah, Martin, thanks for the report. Just a question on this Swansea Bay and the substance misuse data. Do we know the reason that they aren't able to share back?
I'm not close to these particular things, so there is obviously the report has a little bit more detail in there. If you need a bit more than what is in the report, then I'm happy to go and ask the individuals involved for a bit more detail if there's specific questions around that. But no, there's a little bit in the report, and I don't know anything more than what has been documented here.
Thanks, Martin. Yeah, it's just if there's anything we can do to support that process. Yeah, I'll link in with you offline.
Brilliant, thank you.
Brilliant, thank you. Thanks for the question, and also Martin for taking us through the report. Is that there's a lot in the benefits and outcomes as well as in the deliverables that's of genuine interest. So thank you for sharing that with us. And the committee, we are being asked to note for assurance this report, which we so do. We're running a little bit ahead of schedule, about 10 minutes. So I'm going to actually see if we could move on into the next item with Rachel. Would you be okay with that, Rachel, if we do so?
Yeah, absolutely, Chair.
And hopefully that will still come through to around the same time for the comfort break, or the dehydration break, as they're probably called now. But in any case, we'll move on now to item 4.4, the Research, Innovation and Knowledge Management Assurance Report. And I've just mentioned Rachel Sully has joined us, Head of Information and Research. So would you be able to take us through the key points, please, Rachel?
Yeah, of course. Thank you, Chair. So hi, everyone. I'm Rachel Sully, Head of Research and Innovation, and I'm here on behalf of Rachel Powell today. So this paper is presented for noting and updates the committee on the progress across RNI and the NHS Wales e-library, focusing on governance, assurance, data access, service improvement and the forward plan. So the overall position is positive. Both services continue to make steady progress against our strategic priorities and remain in line to our mission. The work supports wider objectives around evidence-informed practice, safe use of data, transparency and service improvement. There are three main areas that I'm going to highlight today. The first is research and innovation governance. So following approval of our 2026-29 RNI strategy, the focus is now on putting those strategic principles into routine practice. So this includes clear approval routes, continued development of our RNI front door alongside the wider piece of work across DHW on the front door access, standard operating procedures and better visibility of the activity that we're involved with that also involves DHW held data. This really matters because it does strengthen consistency and transparency in how research and innovation activity is identified, reviewed and how we support it and make sure it's fully assured. And then also supporting clearer decisions around data access and use. The forward plan is really to continue developing those operating procedures, define those approval routes and those clearer roles and responsibilities, so we're making sure that RNI activity is well governed. The second point I'd like to raise is around the Digital Economy Act accreditation. So DHW remains accredited for the preparation of data under the Digital Economy Act until the 28th of February 2027. The UK Statistics Authority issued the 2026 notice in June this year, and we submitted all of our evidence at the end of July. The Research Accreditation Panel will be considering DHW's accreditation on the 29th of September, following the planned site visit and security meeting that was held yesterday, with the capability meeting being held on the 16th of September. This year's review focuses on access control, operations, security and system acquisition, development and maintenance, alongside some of the selected capability controls, which covers data governance, people capability and service provision and processor obligations. The key point for committee is that the accreditation provides external assurance around DHW's controls for safe data handling and supports our role in preparing and processing data for approved research and statistical purposes. So as I mentioned, the forward plan there is to continue progressing the DEA with our capability meeting planned for later in September, and then respond to any recommendations or actions arising following the Research Accreditation Panel report, which will probably be with us early October. The third item is the NHS Wales e-library. So to note that the e-library continues to provide access to digital knowledge and evidence resources that support evidence-informed practice across NHS Wales. Current priorities include improving access to full text resources through the deployment of LibKey Nomad and strengthening that supplier collaboration, improving accessibility and user experience across digital platforms, alongside developing our open access arrangements to increase the visibility of NHS Wales research outputs. The key message is that the service is not just sort of maintaining access, but is improving how people discover and use them. And so just as an example, some data we've received today on LibKey Nomad, where it has been rolled out already in the first 3 weeks of August, we've seen 3,500 full text accesses just through that new service. So we're hoping that what we'll see is an increase in usage and therefore better value for money of the resources that we procure. The forward plan now is to review implementation and feedback during 26-27, continue those supplier engagements around accessibility and user experience, and progress the open access agenda. I also just want to briefly highlight the Research, Innovation and eLibrary Conference that was held on the 25th of June. We had 110 attendees across NHS Wales and partner organisations, both in person and online. It was well received and really provided that platform to showcase activity and share good practice and strengthen collaboration across our strategic partners. Planning's underway for next year's conference, which we've planned for the 10th of June 2027. And the proposed theme is going to be around demonstrating value, which aligns well with how we want to showcase research, innovation and knowledge services to show that they're improving outcomes, better use of evidence and learning. In terms of risks, the key issue is the continued pause in the organisational change procedure, which affects the pace of planned workforce and structural development across both R&I and the e-library. But core services remain operational and the teams are managing the position through prioritisation and flexible use of existing roles. And those risks and dependencies continue to be monitored through our internal governance arrangements. So in summary, the committee is asked to note the progress across R&I and the NHS e-library. The key points, just to reiterate, are that governance and assurance arrangements are strengthening, DEA accreditation work is progressing to timetable, and the e-library service improvement remains focused on access and usability as well as evidence-informed practice. Alongside that, the main risk relates to capacity and pace of delivery while the OCP remains paused. So I'll pause there, Chair, and I'm happy to take any questions.
Great, thank you, Rachel. It's very reassuring to have the update. I remember probably 3 years, maybe even 4 years ago, I asked the genuine question about the value of the library, and I remember Iridian gave me and us a good 5 or 10 minutes without drawing breath on the real value of it. And for somebody who didn't appreciate that before, that stuck in my mind. So I'm always very interested to see how that the updates on that. So thank you for that. I know you'll be keeping us informed about any impact through the pause on the development of the team and the specific assignments that the team are dealing with in terms of the OCP. So I won't ask too much about that, but I know you'll be keeping us informed if there's impact that is of concern. And you've already explained that you're managing that through reprioritization. I think that's something we all probably need to get used to. We don't know what's going to come out of the broader pause, within the new government yet, of course. So some of us won't be too surprised if the pause turns into, whatever the word for a longer pause is, so we may have to get used to a new working environment in terms of those things. So it's a good thing for us to actually be thinking afresh about priorities. But thank you for that. I see no specific questions arising other than those points. So I'm going to thank you, Rachel, for the report. And the committee is being asked to note the report for assurance, and we so do. At which point we will take the dehydration break. I don't know if you saw some of those World Cup dehydration breaks where it was practically raining when they were taking them, but we're going to do that anyway, no matter what. So thank you for being with us. We'll take 10 minutes and we'll restart again in 10 minutes time. So that's at 20 past. So thank you. See you then. Great, welcome back everybody to the meeting. I note that that Michelle Sell and also Alex Percival and Gethin Bateman have now left the meeting. Thank you to them for their attendance at the earlier part of the meeting. We'll move on now to the Wales Informatics Assurance Group report, which is going to be, I think we're going to have that taken through by Jamie. And welcome to the meeting, Jamie, our Quality Manager for Regulatory Compliance. And Jamie, over to you to pick out the key points that we might want to be made aware of.
Yeah, thank you, Chair. Afternoon all. So yeah, I'm Jamie Manning, Quality Assurance and Regulatory Compliance Manager in DHW, covering the WIAG report. So the most significant points of the report are the deployment position, any outstanding approvals, and whether escalation is required. The report provides the committee with an overview of WIAG activity and the current assurance position of work that has entered the process. The key messages for this reporting period are that 7 projects reviewed for deployment, achieved WIAG and Executive Medical Director approval. There is 1 safety case and readiness report pending. 24 active projects are progressing through the WIAG Power App, and there are no matters requiring escalation to the committee this quarter. For information, in addition to this committee report, WIAG activity is reported through a monthly quality report shared with the Integrated Management Systems Assurance Group and Quality and Regulatory Group. The 7 projects that achieved WAG approval were the Digital Learning Portal, NHS Wales app, the digital document section, Secondary Care EPMA for Powers Teaching Hospital, CARFORB, Radiology, Electronic Test Requesting, Hull University Health Board EPMA, and the digitisation of nursing documents, specifically the peripheral intravenous cannula. The 2 safety case and readiness reports that are included in the report, these are projects that predate the Power App, and both of those are the safety case and readiness report for LIMS 2, Tranche 3, which includes microbiology and cervical screening modules. This is ongoing, and the digitization of nursing documents that's included in the approved list. The Power App is providing us a visible record of the active assurance pipeline, but the spread of submission dates means that continued oversight of progression, especially with older submissions, remains important. But to note, the pipeline slide confirms the projects that are pursuing assurance approval. It doesn't state that the older submissions are delayed. The forward look identifies 4 projects that requested to attend WAG in the next reporting period. These are 360 feedback tool for DHW, endoscopy ETR pilot, clinical coding workbench, and solar winds, which is a monitoring system or application. For information, the forward pipeline is known and the appropriate engagement route has been identified for each item. As I mentioned at the beginning of the agenda item, there are no key risks or matters requiring escalation to the committee this quarter. And the report also provides a high-level update on the WAG improvement activity, but there is a deeper dive regarding that for the next agenda item. So in regards to this report, I'll stop there. Thank you, Chair.
And thanks Jamie for taking it through, and it does take us through to the deep dive, AI deep dive in the next agenda item. So thanks for teeing that up.
Sorry, Alistair, this one it's not an AI deep dive. That one is for a future committee when we get to that point that we can actually articulate how AI will be assured via WIAG. So this one's purely around the WIAG activity, improvement activity.
Gotcha. Thank you for that clarification. That's really helpful. And I'm looking at colleagues to see if there are any questions. Rudy, and I see your hand up.
Yeah, quick shout out, please. On the
Sorry for also getting you while you're just finishing off chewing something, Rudy. I should have waited for about 10 seconds.
As my mother said, don't speak with your mouth full. So I'll continue.
Right. I've just bought you those 10 seconds, by the way.
Yeah, put on record my thanks to Jamie for running the WIAG process. It's a difficult job lining up the ducks, but he does it very well. And I want to assure this committee that that process is running smoothly and the relevant people are doing their job to a high standard as we would expect. So thank you very much, Jamie, for doing that. The Power App has definitely made it easier, an example of a digital tool, making something that was a little bit tedious, say, Jamie, a little bit easier. So thank you very much for the development of that as well.
No problem. Okay, I'll jump straight into the report that covers the WIAG process improvement pilot.
Thank you.
So the purpose of the pilot is to improve how work enters and moves through the WIAG assurance, but while maintaining governance, controls, assurance lead oversight, and final approval routes. The central message that we're pushing is that this isn't about reducing assurance, it's about making assurance more timely, transparent, proportionate, and easier for work owners to engage earlier in the delivery life cycle. In the report, there's a breakdown of projects since adoption of the WIAG Power App. So since the adoption of the app in February 2025, 21 projects at the time of this report have gained full assurance, spanning the period from February 2025 to July 2026. The average assurance journey is around 8 months. The quickest turnaround for full assurance was 7 weeks. That was completed in July 26, while the longest assurance journey was 12 months. Now, the breakdown of this shows that the majority of projects gain full assurance within 5 months, but there is significant variation in the overall journey time. And the point here is not that WIAG is failing. The data we've pulled from each project shows assurance is being completed. However, it also shows how it is completely dependent on the nature and complexity of the project that dictates the overall journey time in WIAG. which indicates there's obviously an opportunity to improve consistency, visibility, and earlier engagement. So the pilot is responding to real evidence and data from WIAG activity, and we're looking at how to reduce avoidable waiting times and improve consistency, not remove necessary assurance. So having looked at the evidence, the desired future state slide sets the scene and the governance principle behind the improvement work. The desired future state is obviously that every system application, feature and change within WIAG's operational remit is assessed against the right controls, assurance requirements, while streamlining the WIAG journey where possible. So the proposed model introduces a risk-based entry point to digital assurance. This gives work package owners a clearer way to evaluate assurance needs promptly, start defined assurance activities sooner, and receive proportionate requirements without being dependent on fortnightly meetings or time-sensitive correspondence to agree next steps. The key principle is shift left assurance. We want teams to identify and begin proportionate assurance activities earlier, while retaining WIAG and assurance lead oversight as the final assurance requirement authority. That will not change. The future model is risk-based and front-loaded, but remains governed. But the aim is better governance effectiveness, not lighter governance. I'm going to see how many times I say governance in this speech. That moves on then to highlight there are factors at play, as is with most things. The analysis of this identifies several factors influencing assurance timelines, which are people, process, technology, and the delivery environment. On the people side, there are new work package owners all the time. We've had quite a high turnover of assurance leads. From a process perspective, assurance requirements may be identified at later stages. There may be limited visibility of next steps, and obviously the reliance on the quarterly meetings. The technology factor is limited automations and notifications, but this is being improved as we now have notifications for the assurance leads, but there's still a way to go. While the wider delivery environment includes increasing demand for faster implementation, and obviously the complexity of digital programs is increasing. So this tells us that the issue is obviously not one single bottleneck. It's a combination of process maturity, visibility, timing, complexity. So therefore the solution needs to improve the operating model rather than simply asking teams to work faster or harder. But the improvement targets the causes of delay, so it's late identification, unclear next steps, and dependency on meeting cycles. So the pilot process section in the report explains how the process responds to these factors. The pilot process has four main components, which is increasing the visibility of WIAG front door, which is the entry criteria, improving the assurance quality plan, creating an impact assessment, and supporting agile delivery approaches. The first aim is to increase visibility of the WIAG front door and enable self-service route into assurance. So that reduces uncertainty about when and how projects should engage with the assurance services. The assurance quality plan has been redesigned following previous WIAG submissions, assurance lead feedback, and Power App data. And the aim here is to capture key information earlier, reduce clarification cycles, and allow WIAG discussions to focus more on assurance requirements, decision-making, rather than basic information gathering. The impact assessment to provide a structured way to determine what WIAG assurance is required and where it is required and what level of assurance is proportionate to the risk and impact. And this is the key process change. We're looking at moving from a model where WIAG is often the first place clarity is created to a model where the work owner arrives with better information, early impact thinking, and clearer proposed requirements. We have currently trialed the WIAG entry criteria, the front door, on 4 projects. This has had positive feedback so far, as work owners do not need to wait for the WIAG fortnightly meeting to get an answer. 2 of the submissions were assessed as WIAG assurance was not mandatory, with the remaining 2 submissions only required 1 assurance area each. This averted both of those projects being pushed through the full WIAG assurance route, but maintains the WIAG oversight and ability to gain that proportionate assurance. So progress so far has been good. The WIAG entry criteria has been developed and subject to continuous improvement as the scope of work DHW undertake is incredibly varied. The AQP has been developed and the impact assessment framework has been established across all 20 assurance domains. The assurance requirements are being catalogued, linked, and the initial stakeholder engagement has been completed. Again, we've had positive initial user feedback, and the first pilot of the entry criteria assessments have been completed, which I said was 4. There was 2 when this was written, but we've managed to get that number up to 4. There are still 2 key steps to finish. The remaining assurance process flows, impact considerations and delivery requirements for the remaining 5 assurance areas. The reason for this is they're more complex, such as infrastructure and testing, so we need a bit more work to define what those requirements will be. But it is to be noted that this is not being presented as a finished operational model. It is a pilot with strong foundations, but further validation is required, particularly through an end-to-end pilot of a project. The value observed so far through the design and the early pilot work, it's highlighted 6 main benefits. The first is the entry criteria, because it helps address ambiguity around what needs to come to WIAG. Second, the revised AQP enhances the front-loaded information for assurance leads by capturing core information needed to allow assurance leads to make informed decisions in a timely manner. Third will be the proportionate assurance is more visible, because the impact assessment asks the users to select the impact level for assurance areas and makes clear that the requirements will auto-populate based on the selected impact level. This is caveated that completed assessments will still remain subject to full WIAG review and verification before they move forward. Fourth is the work package owners can start clear actions earlier. The process identifies where action can be initiated without waiting for WIAG. For example, MDR assessments, booking yourself onto TDAG, ISD assurance group, and a flurry of other assessments that are required. And fifth, we also wanted to support the process for requests for change by distinguishing between new work and existing assured work. So finally, it creates a foundation for future digitization, because the process already behaves like a requirements catalog, rules engine, and linking assurance areas with the impact delivery, risk considerations, with the evidence and artifacts. So the key message from this is that the pilot will not just be administrative. It creates a stronger operating model, clearer entry criteria, better quality submissions, visibility, proportionality, and a better change control to move forward. There is a proposed WIAG process flow in the report. This illustrates self-assessment activity by the work owner and what is WIAG-driven activity. It indicates a proposed split of 30% WIAG-driven activity to 64% work owner or self-assessment-driven activity. Just to emphasize that the self-assessment does not equal self-approval. Work owners can complete the structured assessments and begin clear, obvious, and/or initial actions earlier, but WIAG assurance leads still verify and approve the assurance requirements as they do now. So again, from this, there are 2 slides that show what this could mean in practice for waterfall and agile delivery approaches. So I've named them the art of the possible. So when it comes to the waterfall, this illustrates how the proposed process could work for a waterfall style delivery route. It shows the sequence from work approval right the way through to final approval. The important shift is that the work owner can begin upfront and initial clear requirements earlier rather than waiting for the WIAG meeting to be held. The slide also sets out review expectations. If the entry criteria concludes WIAG is not mandatory, the assurance leads are given 5 working days to challenge the assessment and come back to see if they have any further requirements, wants, or needs. The art of the possible with the agile. So obviously this considers agile delivery. The aim is to align WIAG assurance activity with agile planning rather than treating assurance as a separate activity that could occur after delivery decisions have been made. The proposed approach includes reviewing the proposed sprint backlog before sprint planning for WIAG entry criteria, existing assurance approvals and existing impact assessments. The backlog review considers whether the work introduces new features, affects patient safety, includes new data flows, or affects existing integrations or affects infrastructure, so that we can get that clear visibility of what is in the backlog so that we can do some of the assurance work up front. So it also recognizes that agile releases are typically lower in complexity and incremental in nature, so assurance activities should be incorporated directly into the sprint backlog and managed alongside development tasks to make this possible. The overall assessment so far, so feedback received to date, has been largely positive, with stakeholders recognising the benefits of early engagement, improved transparency and clearer assurance requirements. So the early signs are positive, but the process must continue to be tested, particularly through a full end-to-end pilot. So to close, the WIAG process improvement pilot is seeking to move assurance earlier in the delivery cycle, give work owners clearer routes into assurance, improve the quality of information received by assurance leads, and reduce avoidable delay caused by meeting dependency or late identification of requirements. The key control point is that self-assessment does not replace WIAG oversight. The proposed model keeps WIAG and assurance leads as the verification and final assurance requirement authority, whilst giving the team structure to prepare earlier and progress known actions sooner. Thank you.
Jamie, thank you. And what a very, very comprehensive run through. I've learned that you need to listen to Jamie Manny very carefully because there's an awful lot in what you put across there. So thank you very much for doing that. I see Ridian with your hand up.
Yeah, agreed, Chair. Very comprehensive. We won't need to repeat that on next occasions when we do updates. But I think it's important that we set the foundations and reassure the committee that we take the assurance process extremely seriously. We dot the I's and cross the T's, and we will continue to do so. Thank you, Jamie.
Indeed so, yeah, thank you. And Chris?
Thank you, Chair. Thank you, Jamie. Yeah, just I agree with Ridian, really important, and it keeps us safe, this process, but there is a balance, isn't there, between speed and agility. People want digital systems quickly, and getting the right balance between assuring them and doing it quickly. And Jamie, in the report, it talks about the assurance journey being 8 months. So I guess my challenge is that quick enough? Can we safely reduce that down? And then the second question linked to that is, it talks about the current process being a meeting-driven process. So can we reduce the number of meetings? I know this is always a balance between getting the assurance right and doing it appropriately and quickly, but I'm asking those questions.
Yes, so it's quite difficult when you look at the data because, as I mentioned, it is dependent on how complex the project is. Like, we've had a year turnaround to a 7-week turnaround. When we dived into the data, it was clear that the more complex projects needed upfront clarity. So actually, to meld both questions, there is a meeting that happens fortnightly. That is the WIAG meeting. We're not going to reduce those meetings. What we're going to do is introduce processes to allow people to get the answers they need outside of that meeting. So that's the whole point of the entry criteria and the impact assessment, so that we can have a 24/7 assessment, and we don't have to wait for that 2-week block for them to come and deliver their show and tell us all about it. And then at that point, we start to set the requirements. Again, the 8 months, I'm struggling with the data because it is purely project dependent. And what we're focusing on is the improvements that I've mentioned during the agenda item should drive that 8 months right the way down. And we should be able to start to see a consistency. And what I want to do is offer a similar project to offer up a timeline, because it's almost impossible to state how long you're going to be in WIAG. But what we can do from the data that we've got is offer similar projects to state, well, this project is in the same vein or the same nature, and it took X amount of time. These were the lessons learned, because obviously after every single submission, and once Ridian signs off, I'm going to be doing an assessment to see basically what went well and what didn't, so that we can drive that continuous improvement.
May I come in, Chair, please?
Yeah, please, Ridian. I was just going to bring in.
And I might draw Chris Collis into this. We've gone through a transition sort of programs to product. The product owners are responsible for driving the train, for want of a better word. They've got to make sure all the carriages are on the track and that they're safely on the track. There will be some variability. Chris Darling, we can't have an average of this, I'm afraid, because of the complexity of the different programs. But the purpose of reviewing, and it's been reviewed a number of times since I've been chairing this process, since 2015, is to emphasise to the product owners that it's their responsibility to line up the ducks. Chris Collis, have you got a comment on that?
Yeah, no, I completely agree. And as was mentioned in that update, all about the shifting left, it's about doing these activities early on, so that by the time you get through to an assurance meeting, nothing comes as a surprise. You should be able to just present the evidence that's already been gathered during the development process. And it ties in with one of the other things we're looking at, which is service assessments, which is something from Government Digital Service. They introduced them circa 2014, I think, onwards, and that was to do assurance around how products are being developed. So are you talking to your users? Are you using best practice in the cloud and how you build things? There's a whole set of criteria there. And the process was between phases of a product's development, which typically could be 6 weeks, 12 weeks, 6 months. Between those phases, you'd have that assessment, and actually whether you pass that or not is whether you can move to the next stage of your product. And one of the key things in my experience from being involved in that process was, don't wait until 3 weeks before that assessment to then start gathering the evidence, because you find yourself needing to retrofit processes to your product because you haven't done it from the start. And the teams that were most successful were the ones that continuously assessed themselves against those criteria and course corrected throughout each of their phases, so that by the time they got to the assessment, they could just answer off the top of their head all of the questions, because it was embedded in the way they were working. So I'm completely on board with what's being proposed here, and really supportive of our product teams getting involved in that and making sure that the process is as smooth as possible. I think if products are failing that assurance, then it's something we need to fix earlier in the process. It's not the assurance that's the problem at that point.
Thank you, Chris. Some really salient points there. And Marilyn.
I just wanted to come in and say, reiterate really comprehensive information from Jamie. And I think Chris's question was apt as well, really. And I did like your response, Jamie, because everything is different. And it's nice that we are actually applying that the different levels of attention depending on the complexity of each project. So that's really useful to glean. And another thing I just wanted to add as well, on Chris's last point, is that it sounds like the teams that were more responsive and reflective just organically responded to the problems and worked that out. So that's a good way of us working in the future to, like you said, rather than wait until perhaps possibly a scheduled meeting, to just be working in that way. So yeah, I just wanted to raise those points. So Jock and Val, thank you for all the work that's been done.
Thank you, Marilyn. Thank you for that. I think there's a lot of support for this approach. I must say that I really welcome looking at processes to see how we can actually make them more effective, more productive. And it looks to me like there's the essence of good, strong project management behind this, because you're really looking at what ways you could actually make the processes fit more effectively together to enable that balance that I think Chris has talked about, and Jamie, you've talked about, Chris too, which is getting things done and getting things done with the assurance that we all need. And there is always the tendency, isn't there, in public sector, for us to move more strongly towards the getting things done with every bit of assurance we can possibly pack in there. And it's not to say we're throwing away that model by making it work better for us. Getting things done and operational is just an extremely important part of what we do. I really like that. I really like also, Jamie, the way you're talking about the strongest value added aspects of what we do, and I think that's a really good way of looking at the approach we take and the impact we have in our different reports. So there's some very good stuff there. Thank you.
Thank you,
great. So thank you, and that's two reports that you've taken us through, Jamie. So thank you for that. And as I say, it almost bears watching this again just to listen to what you were taking us through, Jamie, because you covered a lot of ground very thoroughly and very comprehensively. So thank you for that. This is a report for us for assurance, and the first of the two reports was for us to note for assurance, which we so do. And we move on now to the item 4.7, the Technical Design Authority Assurance Report. And Chris, I think you're going to just segue neatly into taking us through this. You're the Chief Product and Technology Officer, but please take us through the key points from this, Chris.
Thanks, Chair. Yep, Chris Collis, Chief Product and Technology Officer at DHCW. And this is the Technical Design Authority update paper for noting. The TDA remains a key part of our governance, and it provides our architectural oversight across the organisation. It sets and maintains our architecture direction, principles, standards, and patterns. So it's very important. And it also works alongside a subgroup called the Technical Design Assurance Group, or TDAG, and that carries out a more detailed technical assurance on an individual work basis, escalates to TDA as needed. And the role of these in combination is to make sure that our technical and architectural decisions are aligned with our strategic direction and principles. So since the last update I provided, which was in May, the TDA has met once. That was at the end of June. One of the things from the April meeting of the TDA was around technical debt. We discussed and agreed that we wanted a more structured approach to managing technical debt within the organisation. One of the actions out of that from April was to agree a definition of what is technical debt for the organisation itself. So that was actually completed. We created a definition of technical debt. We discussed that in June and agreed it as an organisation. We've published that on our public architecture website. I'll put a link in the chat. And in the paper itself, I tried to add some footnotes in for members of this committee to try and understand, because I know some of these things can be quite technical and cross over into different domains. So it was to explain what is technical debt. The full page there in the link actually gives you all the detail, and if you're so inclined, you can go and look at that and understand all the different types of debt that can exist within a system or a product. But essentially, it's the accumulation of items over time that slow us down or make things harder to change. That's what we call it, debt. And the analogy is very much like financial debt. It's okay to take on a small amount as long as you can pay off the interest. If you fail to be able to keep up with the payments, it becomes a massive burden, slows you down, and stops you from being able to progress. So we need to manage that debt carefully. So now we've got the agreed definition. We've started making our teams aware of that through TDAG and other forums, and we're going to be using that definition when our teams bring us changes or designs or architectures, and if it doesn't align with our principles, then we'll be asking them to categorize that debt, capture it, and set a target date for when that's going to be paid off. So I think having that definition just helps us remove any ambiguity as to what we're talking about. So that's on technical debt. Second part was around the national principles. So when I last reported, our TDA member had been given the amended national architecture principles that the standards and architecture group had agreed, and we were reviewing those for acceptance into DHCW. And you may remember it was actually DHCW that drafted the original principles, and we used them with our own organisation and then submitted them to the National Board to see if they could be fit for purpose on an NHS Wales wide basis. That Standards and Architecture Group accepted those principles with a few minor amendments. So this was just closing the loop, bringing the amendments back into our TDA for ratification. And in June, we agreed we were happy with those amendments, and we've now adopted those architecture principles as DHCW's own. So essentially we're saying now, we will point at the national architecture principles and we will use those. And then over time, we will either update the national ones through the Standard and Architecture Group, or if we feel there's some particular exemption that we need for DHCW, we'd manage that through our TDA and report back to the Standards Group, but not expecting that as of today. So one of the actions off the back of that, and one of the ones that I took, was to work with that Standards and Architecture Group to update the very website that I published in the chat there, which holds our architecture principles, to update that so that it reflects that these are now national or nationally agreed principles. So I'm just in contact with Mark Wardle, who's the chair of that Standards and Architecture Group, to get that change agreed. And then the website will be updated because currently they're flagged as DHCWs. Okay. On solution architecture, I think when I last reported, we had an outline plan for a solution architecture strategy. I put that in air quotes, the word strategy, because we brought the full version of that document to the TDA in June, sets out how some sort of basic building blocks for building new products and services. And if you was to follow those building blocks, then you're picking up on the architectural principles and following good practice in the industry. We discussed it at TDA and actually decided it's not a strategy, it's more of a playbook or a professional guide for how our team should operate. We're trying to distinguish between strategies and other things within the organization, as typically everything gets called a strategy, which kind of has different perceptions around it and different rigor, let's say, within the organization. So no longer a strategy. We now have a solution architecture playbook. The TDA agreed that it's actually for our architect colleagues within the organization and the design assurance group to agree what those rules should be within that playbook. So we kind of delegated down as part of our continuous proposal to push decisions down in the organization rather than having the higher up committees make decisions about things they're not necessarily fully qualified to understand. So that's now gone back to our design assurance group, and they're starting to adopt those patterns in that playbook. And I think we will seek to publish details of that again via our architecture site going forward, so we can share that good practice with other organizations and make it visible in the open. So, and then the final thing I wanted to flag, and I don't know if this is perhaps too much detail for this committee, but you may recall in previous updates I said we'd introduced this concept of architecture decision records, which is a way to capture concise decisions that have been made in short form text with the rationale, consequences and implications. And the way we'd introduce that was to delegate responsibility to our teams again, to make sure the right people are involved and bring the decision to our assurance groups rather than ask the groups to make the decision. So one of these has actually came up in the last session of the TDA, and we have a proportional governance system. So we say, actually, if it's a project level decision, the team can make that autonomously. They don't need to ask for any support. But as you go up the impact levels, we ask for more engagement. So this one was brought up at TDAG, so the subcommittee of our TDA, and that group then flagged, actually, this looks like it might have a national level impact if you were to make this decision. So we followed the process we'd introduced. It was escalated to our TDA group, which is the highest level for architecture in the organization. And then we've the process is that we've identified the right people to be involved in that decision-making process, and then ask them to go and make the decision, and bring back the outcome. So again, rather than TDA making the decision or ratifying it, we're getting the right people involved and making sure that we've agreed who should be involved in it, not deciding it ourselves. And this was around certificate automation. So it's quite a technical topic. I don't know if we want to go into the details. I tried to put some, again, footnotes in the paper itself to explain what this is in terms of the technical terms around certificates and domains and DNS. So I won't go into all that here, just to say that a team's been formed within DHCW to look at the problem space, and we expect them to come back to the TDA with the decision that they've decided around this process that needs updating. Essentially, in short, it's something we're doing manually today, and we actually need to do it in an automated way because it needs to be done so frequently to improve security that it becomes too much of a burden for someone to manually be doing it. And there's various ways in which you can solve this problem. Some of them are buying a product in to do it. Others are you can develop something in-house, and there's a whole range. And essentially the teams will be looking at that. The reason I flagged it has a national implication is because we manage a lot of these processes on behalf of other organizations as well. So if we introduce a different way of doing it, then it may have an implication for them. And there may also be a cost element, if we were to procure a solution. So we need to understand how that's funded and whether that's funded by DHCW or whether there's any kind of cross-charging. So I just wanted to flag it. But again, I'd be interested to know whether this is the kind of information that this committee would be interested in seeing, because it's going to start coming up more at TDA, these kind of decision record processes, or whether we just have that as a below the line kind of statement. Any questions?
Just quickly on the latter point, very happy to have colleagues take a different view, but my own view would be that would be good to include below the line for those who wanted to dive into it. But very happy to if colleagues have a different view about that. We can get into information overload in each section, which won't necessarily help us in terms of our the assurance purposes that we've got. So. But we can make that judgment as we move forward, Chris. It's always good to have the links. Your link with an explanation of debt in this context, I found really helpful. I hadn't come across that terminology before, and it really does help explain the way that we can look at this. So thanks very much for doing that. Yeah. So any specific issues or questions? I think this is an area that we all recognize the importance of, and you've explained it extremely well. So it won't be a surprise for me that people are very satisfied with the explanation. There was one thing, if I may just ask about, and it refers also to Jamie. You mentioned this as well, really, in your report, but maybe not in exactly the same words. Chris, you referred to pushing decisions down in the organization. In the right context and in the right way, I very strongly support that approach. Otherwise, everything floats up to relatively few people, and you have traffic jam in all sorts of ways, and you're breaking through that in your process work, and Chris as well. Is this something that we have formalized, Chris Darling? Is this something we have formalized or that we need to formalize? Have we adequately stated that coming from the board? I just note that it's something that both Jamie and Chris Collis has referred to.
Shall I just jump in on one?
Yeah, please do. Thank you.
Starting, and that's on the architecture decision record. It's something we formalised within the TDA, so only under the remit or governance of the TDA. So I can tell you that one we definitely did. In a previous TDA we'd agreed, and there's a whole process. Actually, I'll put a link in the chat to the agreed process that we came up with at TDA, but I can't talk to the wider. I'll let Chris and Jamie come in on like wider decision delegation, or whether that's an organisational kind of policy.
Yeah, no, that's great. And I see Jamie also with your hand up, and it might be Chris Darling wants to come in after that.
Yeah, so from a WIAG point of view, because of the nature of WIAG, yes, we're arming people to make decisions, but said decisions will always be verified via the WIAG group. So it's not wider arching than that from my perspective.
Yeah, great, Jamie. Thank you. Chris, is there anything you want to add to that, Chris Darling?
Yeah, the only thing I'd add, Alistair, is I think some of these processes have had a kind of fresh approach, which has kind of consistently looked at decision making being made further downstream. Have we got something more corporately? I think the new operating model that's been put in place has been designed to try and encourage some of that decision making. But as you know, Alistair, we're a public sector body. We have a prescribed scheme of delegation. So there are a number of decisions that are reserved for the board, for executive members. But I think where possible, we've tried to push that down as much as possible. I think it's a good reflection point, though, for me to take back, discuss with the exec team, just sense check, have we communicated as much as we could some of the delegated authority points?
Yeah, that's really good. I mean, part of this is not about skipping process. It's about actually making process work more effectively, as come through from Jamie and Chris's reports. And I suppose that I certainly support a lot of that. But why would we not? It's just to make sure that we've got some consistency across the organization if we are taking a slightly different approach. But in any case, really welcome the report, Chris. Thank you for that. Thank you for the work and the detail that was gone into it too. And we are being asked to note for assurance the Technical Design Authority Assurance Report, which we so do. And we move on to closing matters, which is just briefly to cover off that we'll be producing the Chair's highlight report and taking that through to the board with a number of items that we've covered in today's meeting. I don't want to pick all of them out, but just to identify one or two. We began the meeting with some really important discussion around CANISC and the data policy work, data sharing work, and the potential that offers. That led into some discussion, which I think was important, about the way in which CANISC transition is being managed in terms of reducing risk. And we had some, I think, very helpful information around incident review and organizational learning, how that might be developed, how that might be extended to cover one or two other areas. And Chris, I'm sure, I know we are looking at that, and Michelle referred to that too. We can perhaps pick up on that and feed that back to the report, to the board. We picked up on Information Services Assurance Report, some really useful research, innovation and knowledge work too, and the WAG pilot process that we've just covered with the AI deep dive and the Power App introduction. So some really strong points that can come out of that. And lastly of all, we just covered off some, I think, really helpful points in the TDAA report, and thank you for those. So we'll be putting together those notes. I'll work with the corporate governance team over this in the next few days. So it's to move on to 5.2, and if there are any other urgent business issues that colleagues you may have to raise, I see none. So it's just to confirm the date of the next meeting, which, good grief, we're already talking about November. Somebody will be mentioning Christmas anytime soon. But the 19th of November is the next meeting, and I look forward to seeing you all then. We're excellent. We're slightly ahead of our time schedule, which from my perspective is a good thing. Well done, everybody. That's great. We've just bought ourselves half an hour. So I'm going to suggest we take a short comfort break this time. Does that work for everyone? A 5-minute break, or would you rather a 10-minute break? It's whatever works. I don't see any huge resistance to a 5-minute break, given that we had a 10-minute one not too long ago. So I'm going to suggest we do that, and then we're going to come back for the private meeting. And so we'll see you then in 5 at 15:08, at 16:08. Sorry, I'm in another country at 14:08. See you then. Bye.